so we know, for example, that patients on testosterone who also take estrogen lowering medications or estrogen blocking drugs, which we commonly say aromatase inhibitors, but I mean, there are other ones that reduce your estradiol as well. There are even some synthetic androgens that do too, at least indirectly. Patients who take those drugs do not get anywhere near the same visceral fat reduction benefits. And like I said, we know that from studies, but I know that from my own personal practice because what I do, which I think is unique to many doctors that prescribe testosterone, is I do body composition scans. I do in-body 570 or DEXA scans. So I look at people's visceral fat every 3 months. Not only do I closely monitor their blood pressure, their hematocrit or their red blood cell count, all the things that you would typically monitor in a TRT patient. I also look at how their body composition changes, what happens to their skeletal muscle mass, what happens to their percent body fat, and what happens to their visceral fat. And I have noticed in several patients that I've had, usually they transfer out of the care of other providers and they've been on estrogen blocking medications for a long time. Their visceral fat mass doesn't really change until they get off the estrogen blocking drug. And once they do that, their visceral fat goes down, and then other things start to happen that are beneficial. Their sex drive improves, their skin quality, hair and nail quality improves, their insulin sensitivity improves.